Good afternoon, everyone. Thank you for joining us here today. I know it's difficult to get everyone in the same room together, which, I'm glad everybody made the effort to join us today. This is not an issue that we're unfamiliar with, but it's an issue that's good to revisit from time to time. So thank you for being here, and let's get started. So why is tobacco use in youth still an important issue? 9 out of 10 current smokers begin smoking before the age of 18. 3,200 individuals 18 years of age or younger become daily cigarette users. So that's a fairly high amount in the population of youth. It's been down since the onset of real focused initiatives towards decreasing that number, but it's still a number of concern. Some of this is due to new products such as flavored tobacco and electronic cigarettes that have increased the quantity of young people trying tobacco products because they're more cool and more attractive. 73% of reported high school students who tried tobacco products utilized a flavored tobacco product. So this kind of accentuates the problem of these new types of products. Additionally, 11.3% of high school students reported electronic cigarette use within a 30-day period during 2014. Compared to 2011, the rate was 1.5%. So it is a pretty substantial number. It's a tenfold increase essentially. So it's a number that we need to look at, and we need to tailor our initiatives and tailor our approach to address as well. To further emphasize the use, I'm sure most of us are aware of the problems associated with tobacco use. Lung growth during a young person's life is reduced due to smoking, which will affect them later on in life, which in most of these will affect them later on in life, most of these factors. Increased risk of developing cardiac and pulmonary disease, decreased life expectancy, the impeding of physical development and overall fitness, shortness of breath, potentially 3 times as quickly compared to youth who don't smoke, 3 times more likely to use alcohol. Again, the gateway drug, nicotine, which has potential bridging to harder drug use, which in this case, 22 times more likely to use cocaine in some studies. Increased risk of practicing risky behavior such as unprotected sex and fighting. So these all attribute to issues that are found later on in life, habits, ways of interacting socially. So they're all still of concern. This infographic is a little small. Please reference your handouts, just the way it came on the page, which is a little different. So basic statistics, just from some data we've been looking at, 10.8% of high school students who currently smoke regularly in the U.S., 4.8 of high school students in Rhode Island, for instance, smoke regularly. So if you compare that, let's say, to another state that's listed on the graphic, 18.8% of high school students in West Virginia smoke regularly. So overall, we're seeing differences from state to state, and I think that initiatives need to be devised to address very specific areas. States have different demographic makeups, different socioeconomic makeups, so they need to be tailored slightly. And overall, 3,200 individuals under the age of 18 begin smoking every day. So it's not 100,000 or things like that, but over time, every day, it does add up. So it is of something of importance. Youth smoking is an issue that not only affects one segment of youth, it has an impact on males and females and individuals from all walks of life, different nationalities, different ethnicities. To delve into that a little deeper, there are 2 graphics there that are listed that address more on the ethnicity side and compare male-female in regards to those numbers. You'll see that they're pretty steady through the data points. There are some there are some differences between, let's say, African American and Hispanic, where you have a larger percent of males who smoke than females. It's something of concern. It's a matter of addressing these issues so the youth don't feel the need to begin smoking, whether or not it's peer pressure or curiosity. And because of that, to help reduce the risk of smoking, or help reduce help reduce smoking rates, it's imperative to curb issues related to the main reasons why individuals begin to smoke in the first place, whether it be peer pressure, or adult influences. So parents smoke, the odds are that the child is going to smoke. Stress is a factor that's been associated with all kinds of substance abuse, which is no surprise that it affects cigarette use. Advertising, which is still an issue not so much compared in the past, but still an issue now. And then that kind of bleeds into media influences. So cigarette use may not be as high as it was in the past in movies, but we still see role models and things like that in media, whether it be social media or movies, TV, still utilizing cigarettes, still making it look cool, still making it attractive for youth to go, hey, let's try that. It kind of looks cool. So with that, we'll move on to the next slide. So this next slide does look a little busy. It's because it is. So the influence diagram of smoking influences on children. So what we want to focus on is identifying the groups. So we have the cigarette industry. That consists of tobacco farmers and cigarette companies, financial market players, so advertising agencies, the entertainment industry, those that are kind of paid by cigarette companies. And then we have immediate relationships, so we have the impacts of friends and parents. And then there's the public healthcare community. So it's medical providers, school administrators, community organizers, public health professionals, and then larger groups like the World Health Organization and the Center for Disease Control and Prevention, which all have stakes in this issue as a whole. So if you look at the stakeholder slide, you'll see on the left side and you see on the right side. Please reference your handouts as well. Might be a little bit more easy to read. So on the left side, we have kind of more the negative side. The right side, we have the positive side, so no smoking. And then kind of in the middle, towards the top, we have the friends, parents, immediate relationships, which can negative or positively affect these individuals. So on the left side, we'll kind of go through the negative aspects first. Tobacco farmers, it's a financial relationship with cigarette companies. They're being paid to grow a crop. Cigarette companies, on the other hand, for the most part, health concerns are somewhat unrelated. They're selling a product. They're trying to sell as much product as they can. To do that, they then pay advertising agencies, which may or may not also pay the entertainment industry. So you kind of have some feedbacks in there. You have some multi-flow channels. The green arrows kind of are relative to money, so you can kind of see the way the money flows. But cigarette companies want that peer pressure. They want the advertising agencies. They want the entertainment industry to go after these kids and influence them to begin smoking so they have them hooked. On the right side, you have the healthy side. You have everybody who has a stake in keeping these kids healthy: school administrators, medical providers, community organizers who are involved in implementing policies and getting a movement and getting people behind these initiatives, public health professionals that are working on these initiatives in conjunction with areas and groups like the CDC and the WHO, who are ultimately trying to reduce risk factors for future disease later on in life. So as you see, these kind of flow into the no smoking side. Parents and friends, friends can go either way. If you're hanging around if you're hanging around friends who are healthy, good lifestyle, not smoking, they're more apt to be on the good side. However, if you have friends who are who smoke, who have a lot of influence peer pressure wise, then they can negatively influence those decisions the child's making or the youth's making. Parents on the same thing. Parents who smoke may or may not have an opinion on whether or not their child should smoke, but also that role model example there, and on the healthy side as well. So overall, it's very busy. There are a lot of stakeholders. Most of you are here today. I think it's good to look at everything as a whole to see how everything kind of plays in and how we all interact with each other. The next slide, kind of ideas for dissemination of information to the target audience. So we want to reach the youth, and we want to, at the same time, prevent as much cigarette sales or e-cigarette sales as much as possible. So a few ideas just to get kind of the ideas flowing, and we can discuss them kind of after the presentation if you have any questions. So to make further strides in youth tobacco use and prevention, the following initiatives may be beneficial. So focusing on prevention campaigns to bring attention to new forms of tobacco products. These e-cigarettes, electronic cigarettes, flavored tobacco, and bridge the connection between them and cigarettes, because they have the potential for the same side effects, same issues later on in life. An idea is to lobby for an increased tax on such products, similar to what was utilized for cigarette use and has been highly effective and proven to drive down demand. To provide increased amounts of materials and funding to programs in youth where tobacco is high. As one of the first slides, some states may not have access to these funds where some states do. And I think there are some disparities there that can be addressed just due to lack of availability of funds in certain areas. Also, with that and with materials and funds, to fully utilize social media, new outlets of information that are always coming up, Twitter, Facebook, Instagram, things like that, even new medias that we haven't even thought of yet, to promote prevention, especially in platforms that are utilized by youth. So just to make more of an impact. Then we want to link prevention initiatives with positive, influential stakeholders to create an environment of prevention. So that right side of the previous graph, to utilize those initiatives that are developed in there, and then utilize the full gambit of the healthy stakeholders. And then to lobby for financial incentives for advertising and entertainment stakeholders to decrease the amount of media promoting tobacco products. But at the same time to potentially increase prevention messaging. So to get other individuals on board, to have them participate actively, to counteract the effect of the negative side of this slide. The cigarette industry, financial market players who are out for money versus the right side, which is out for the health and well-being of individuals. So with that, a couple references that you guys can kind of delve into a little bit more. The first one is actually the large amounts of data that we pulled for the infographic, which is right here. If you have any questions about that, please let me know. I will be happy to answer those for you. And some additional references, which have links also to a wealth of links and a wealth of information to utilize. So I will open up the floor to questions, and thank you for your time. And all right, let's get to the question and answer and brainstorming sessions. All right, thank you very much.